back to the Everyday Therapist. My name is Dr. Deb, and this is a place where we talk about all sorts of things psychological and clinical. Now, I know I haven't been on for a bit, and that is because I've been doing some writing. I now have a Substack um, set of articles that you can go look at, and I'm also, besides uploading these particular videos to YouTube, I'm also uploading them also to my Substack and to Spotify and to Apple Tunes. So there are multiple places where you can go watch these videos or just listen to them since they function pretty well as podcasts. So last time we met, I said the next time we were going to be talking about narcissistic personality disorder. And yes, that's what we're going to talk about. Now, I should point out that for me, in my actual clinical experience with somebody with narcissistic personality disorder, someone with that type of problem does not necessarily come in to see a therapist to address that problem. Uh, they will come in for other reasons, such as a substance use problem, or as in coming in with a spouse or a significant other or family members to address problems within the whole dynamic of the situation. So let's talk about what makes somebody end up with this label of narcissistic personality disorder. Well, first of all of us do, well, for the most part, have some narcissistic tendencies or traits in various situations. If we didn't, like if I didn't have some, I would not be able to do YouTube videos and say, here, I know stuff, and I'm going to tell you my stuff, because I have to have a certain level of confidence that I have things that you might find to be useful. And this is the case in all sorts of situations. So, somebody who has no narcissistic traits at all is someone who probably doesn't do much of anything in terms of putting him or herself out there in a more forward way. But that doesn't make somebody a narcissist. Somebody might say, okay, that person is being confident, or the person, him or herself, might say, I'm being confident about what I know. Now, someone looking in at that person might say, oh, because that he or she's putting him or herself forward, that may mean that the person is a narcissist. But that's just somebody looking in and not seeing all of the aspects of that individual. So let's talk about what someone who truly is a narcissist, uh, their kind of behaviors. First of all, somebody who can be labeled or get the diagnosis of narcissistic personality disorder is somebody who shows pervasive grandiosity in many areas of life. And, and the grandiosity can be in terms of behavior or just fantasies about how wonderful the person is. For example, when I was a kid, a cousin of mine, I overheard her she was doing a task, and as she was doing the task, she kept saying that she was great, that she was great. I thought that was kind of unusual, but that's before I understood about narcissism. So that was somebody who had some kind of sense of grandiosity, probably a fantasy about it, but did have that sort of feeling. Now, these behaviors can be seen starting in early adulthood. That's when we can start making the diagnosis. But let's look more about what these criteria are. Okay, first of all, somebody who is narcissistic is likely to exaggerate his or her achievements and expects everybody else in the world to recognize that person as being so great. As my cousin who kept saying, I am great. Her expectation was that everybody would recognize her as great. Now, in terms of also being recognized as great, the individual is likely to expect people to treat him or her as being great. They feel entitled to certain respect and behaviors towards them. Another criterion, they have, as I said, about fantasies. They have fantasies of how successful they are or how they will become successful, fantasies about having power over others in situations, how brilliant they are, how beautiful uh, how wonderful the love they will acquire in the future, or even at that point in time. So they have these fantasies, this sort of exaggerant fantasy life. They also think, as you can imagine from all this, they think they are special and unique, and that the only other people who can truly understand them are other people who are unique and special. And so they want to find those other high status people who will give them the admiration that they want, because admiration uh, is really important to people who are narcissists. They need what can be stated as is supply. They need fuel to help them keep going, and they need that admiration, the pats on the back, or uh, the love and admiration. Now, another aspect of somebody who's a narcissist is they these people tend not to have any feelings of empathy. They don't understand how their behaviors can make other people uh, feel bad about themselves, or make the other people feel guilty. They just don't understand that at all. So, for example, someone who's a narcissist may decide, well, I can have affairs and it's not going to hurt my spouse at all, because my spouse is not doing what I want my spouse to do. And so that's another thing that doesn't get listed in the diagnostics, but people who are narcissistic are not very good at taking responsibility for their actions, especially if those actions are going to hurt other people. They tend to put it back on the other person. In other words, saying, you made me do it. I didn't make the choice. You made me do it. Also, they tend to be envious. They see somebody else who might be higher status, and so they want to have that same status, or have be even higher. So they are full of envy. And we'll get to a discussion about why this occurs. And finally, what goes along with all of this is that they tend to be arrogant or haughty, again, because they think they're better than everybody else. And so uh, they come across as trying to be better than everybody else. Okay, so how does somebody end up in having a narcissistic personality disorder? Well, if you watched my videos about trauma, frequently what happens is, if, say, uh, a child who experiences some kind of loss or abandonment between the ages of about 5 or 6, and early teenage years, that child will begin to sort of reject uh, the the situation, and just sort of say, I'm going to do what I want, and everything's owed to me because I've been hurt, and I don't care anymore. And that's sort of the groundwork for narcissism. And it especially is the case if there are other family members who are also narcissistic. I had a situation once where I had a client who sought me out because this person had a substance use problem. And he realized that his substance use was hurting his wife and child. And so he wasn't truly a narcissist, but he had a lot of the tendencies. And it turned out that in his full family situation, his mother had gone off to rehab for a certain drug related problem when he was about 9. And at that point in time, no, he was in sports, and no one was coming to watch him compete at all. His father wouldn't show up, and his mother, who had been coming, wasn't available. And so he this client got to the point where he just didn't care, and pretty much said, I'm going to do what I want to do, but I still want people to give me, pats on the back, because what happens is the person who's narcissistic is kind of hollow on the inside, and they need constant admiration to fill up that space. And the thing is, this person, when his mother left, the space was there. And it wasn't, and it was exacerbated by the fact that it turned out His father was very narcissistic. I ended up with a family meeting with my client, his wife, and his parents. And it was very obvious in the family dynamics as to how my client had learned some of his narcissistic behavior and why he was somewhat narcissistic because of the hole in himself. But his father definitely was the primary reason for the client to have the kinds of behaviors and thought processes that he did. Okay, so that is a situation where family can help lead to the problem, yeah, in terms of role modeling, in terms of setting the situation for the narcissist to uh, become the way he or she is. Now, in terms of prevalence of narcissism, well, as I said, they tend not to show up in the clinical setting. And so all of our estimates of how frequently they appear um, in the population are very reduced because you have to base it on clinical presentation. And so in terms of clinical presentation, the estimate is 2 to 6% of the population. Many people would say that's really an underestimate, but that's the data we have. And in terms of male versus female, the current data suggests that it ranges from 50 to 75% male, and then usually a smaller percentage of women being narcissistic. But again, that's based on clinical data of people who are either in some kind of clinical setting, such as a rehab, or who are willing to self-report. And there aren't that many willing to self-report. Okay, so I said that in terms of my practice, I rarely actually saw anybody who could be labeled or diagnosed as narcissistic personality disorder. Um, and that's because, as I said, substance abuse, they would come in, or they would potentially come in as part of couples therapy or family therapy. And when it was in couples therapy, normally it was a situation of the narcissist being the one that set up the appointment, because what the narcissist wanted was for me to say, oh, you, narcissist, are fine. You're not the problem. It's the other one who's the problem. And I ended up getting fired a couple of times because the way I would manage couples therapy is they'd come in together, then I would talk to one separately and the other separately, then back together. And what would happen is I would hear different approaches to the same issues, and I could tell that the narcissist was the one trying to control the situation. And when I wouldn't automatically side with that person, I'd get fired. So that's what happens. Now, the other way that I ended up interacting with narcissists was kind of indirect. I worked with a lot of significant others or children of narcissists who would come in wondering, okay, what did they do wrong? Why is this person not, if they were, say, in the process of divorce or after divorce, why is this person not following the boundaries I've set? And frequently, our sessions would be working on identifying the fact that no, my client wasn't the problem. It was the spouse was trying to manipulate things, or the ex-spouse was trying to manipulate things just to get a reaction. And narcissists like to get a reaction, negative reaction, positive reaction. It all helps them identify the fact that they are in power. And that's what they want. So, and there's some really good books out there to help people who are in these situations to work through things. And also, there are good websites, and yes, you can see a dog in the back, and YouTube videos and things like that. And the thing is, you can use those resources too, like H.G. Tudor, who is a self-aware narcissistic psychopath, explains all of this. And so I suggest you check out his work. But again, in terms of, say, spouses or ex-spouses that I've worked with, there were situations such as a case where my client and her spouse, soon to be ex, had a daughter in common, and the spouse to soon to be ex wanted their child to live with him and not with my client, the mother. And so the father said to the daughter, "Well, if you leave to go live with your mother or go visit your mother, I will kill myself." Now, he was saying this to a 12-year-old, trying to manipulate that child to uh, sort of join with him against her mother. Um, and so that was a very strong manipulative technique that one could see a narcissist doing. Also, in another couple of cases, I had clients whose ex-spouses thought it was okay to have affairs with 900 to 1,000 other people over the course of like 5 or 6 years. And how they would justify it to themselves and to the people they were sleeping with is, my wife doesn't understand me, so I must do this. And when the wives found out, the ones who end up being my clients, they divorced their spouses and realized that this was not a correct thing to do. However, the ex-spouses would still try to keep my clients in their own circle or loop. For example, in one case, the ex-spouse would still come around to do his laundry at the house they used to own together. And he would use the excuse, well, my kids are there. I must see my kids, and I'm going to come even though you tell me not to come. So that sort of situation happens. So that's with spouses. The thing is, parents, adult children who had narcissistic parents, they have a lot of healing to do as well. There's a really good book out called When Will I Ever Be Good Enough? And it focuses on narcissistic mothers, especially in terms of their daughters, because frequently in these kinds of families, there will be one child who will be the scapegoat of the family and another child who will be the golden child. And the mother, especially, will start living through the golden child. And then all the family troubles will be uh, put at the feet of the scapegoat child. And it takes a lot of time for the children to, as children, they don't understand what's going on. But when they become adults, it can cause a lot of problems as they try to, especially the ones who are the scapegoats, try to find some self-worth because they have been dumped on all of their childhood. And I've had some clients who have been in that situation too. And unfortunately, people who have been the scapegoat with a narcissistic parent, they tend to find spouses that are also narcissistic or partners who are narcissistic, and they replay at different levels these same patterns. And that's because those are the patterns to which they're most used. They they're used to hearing that it's your fault. I didn't do anything. You caused me to do it. So they are comfortable hearing all the gaslighting and the blaming because that's what they've always known. So they take it in and say, okay, I'm sorry. I'll try not to do it again. But there's always a situation in which it reoccurs. So that's what I wanted to say about narcissistic personality disorder. But I want to point out that there's a lot of overlap between all of the cluster B personality disorders. They have a lot of emotionality. There's devaluation in both of people in both, say, borderline personality disorder and narcissistic, because for a narcissist, the goal is to reel somebody in, get all that positive attention, and frequently they do it by what's called love bombing, saying, you're wonderful, tell me I'm wonderful, wonderful, wonderful. And then when the narcissist needs more attention and admiration and it's not getting it, or any other kind of support that the person needs, then the narcissist will start devaluing the target. The same thing happens in borderline. Except in borderline, it's not because the person is not getting attention and things like that. In borderline, the person begins to think the target is bad. Person's good, and then the person's bad, uh, because in borderline, the person reverts back to being basically a 3-year-old who thinks in black and white, as opposed to shades of gray. So there's devaluation in both cases, but it's caused by different reasons. So there's a lot of overlap there. And you can have somebody who might be diagnosed as borderline who has a lot of narcissistic tendencies, or somebody who's narcissistic who has a lot of borderline tendencies, and they both tend to be a bit on the histrionic side. So you've got, and you can have, say, antisocial personality disorder going along with narcissism or borderline. So they all kind of go together. And it might actually make more sense to say cluster B personality disorder rather than breaking it up into these different ones. But that's something for people to think about, and just realize that these behaviors happen. And so that's all I'm going to talk about in terms of cluster B. Next time around, I will begin talking about cluster C personality disorders. And in the meantime, I'm not sure when I will be recording that because, as I said, I've been doing some writing as well. And you can go find my writing over on Substack. I have been addressing some cultural issues from the lens of developmental psychology. So you might find that to be interesting too. So take care, and I'll see you again. Bye.